charges. All right, we're marking a lot of causes this month of October. It is also Sudden Cardiac Arrest Awareness Month. And joining us to talk about this is Dr. Zweibel, System Director of Cardiac Electrophysiology with Hartford Healthcare. Doctor, welcome.
Thank you, Lisa. Thank you for having me.
Sure. Tell us, what is sudden cardiac arrest?
Sure. Sudden cardiac arrest is when the heart suddenly stops beating, usually because of the very fast, dangerous heart rhythm. And patients typically will suddenly lose consciousness. And unfortunately, as the name implies, this is sudden cardiac death. Patients unfortunately die from this.
How is it different than a heart attack?
So a heart attack is when there's a blockage in more or one blood vessels that feed the heart muscle wall, and the heart muscle doesn't get enough blood flow, and that results, if not treated immediately, with death to heart muscle. Sudden cardiac arrest is from an arrhythmia. Many patients who have sudden cardiac arrest have actually had a prior heart attack that leaves scar tissue in the heart and then leads to these arrhythmias, which leads to sudden cardiac arrest.
And what does it look like when a person suffers from sudden cardiac arrest?
Well, patients may have some symptoms such as dizziness, lightheadedness, even some chest discomfort. But many times this is, as the name again implies, is sudden. Patients just suddenly lose consciousness or potentially and unfortunately may just not wake up in the morning.
And doctor, tell us, who is at risk for sudden cardiac arrest?
Sure. So this is typically the same people who are at risk for coronary artery disease and having heart attacks. So these are typically older patients, men, and people who have had prior heart attacks. We always tell patients who have heart disease or have had a heart attack that they need to know what their ejection fraction is, or their EF. That's the percent of blood that the heart pumps out with each beat. And if you have a low ejection fraction, you are at increased risk of sudden cardiac arrest.
All right, tell us about how can sudden cardiac arrest be treated, or can it be prevented?
Sure. Well, you hit the nail on the head. Prevention is key. If you don't have a heart attack and your heart function is normal, your risk of sudden cardiac arrest is actually quite low. And so eating well, a healthy diet, following up with your physicians, taking your medications is critical. But in patients who've already had a heart attack and who are at risk for sudden cardiac arrest, seeing a physician such as myself, an electrophysiologist, through their cardiologist, and being evaluated to have a device implanted called a defibrillator or an ICD. This is a device that monitors the heart rhythm 24 hours a day, 7 days a week. And if it sees a very fast, dangerous heart rhythm, it can either pace the heart or shock the heart to get the patient back into their normal rhythm almost immediately and actually save their life.
Yeah, I had a friend who had one, and it worked when he needed it. All right, Dr. Zweibel, thank you so much. And you see the Hartford Healthcare call to action there, hartfordhealthcare.org/heart to learn more. Doctor, thank you. Very educational.
Thank you.